Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Suhaib Ahmad. He's a surgeon in the United Kingdom. Today's Kevin MD article is Why Even the Best Employees Are Silently Quitting Healthcare. Suhaib, welcome to the show.
Thank you very much, Kevin. Thank
All
you, and
right.
it's a great pleasure. Thank you for the invite. I'm a gastrointestinal surgeon with focus on cancers of the esophagus and the stomach. So, the topic that I'm going to speak about today is an important topic that reflects what's happening around in the healthcare in general. Because I go every day to the hospital, and you spend around 60 to 70% of your time in hospitals every single day. And you wonder, how do you want to spend that time?
Mm-hmm.
Do you want to spend it happily, or do you want to spend it in a sad way, going home after having a stressful day, and how you want to spend the rest of your life? Do you want to spend the rest of your life doing that also? So the connection in the hospital that I'm working in is not very good. So this is why every time I receive a phone call, I tend to go out of the hospital to look at my phone, pick up the phone call, and on the way outside, I once received a couple of phone calls. I wanted to respond to them. I was walking outside the hospital and I bumped into a senior nurse. She called my name from the end of the corridor and said, "Hey, Suhaib." I said, "What have I done again now?" I told her, why are you calling my
Yeah.
name?" And she said, I want to tell you something. It's been over 30 years now in the healthcare system. And I just would like to tell you that actually today is my last day.
Mm.
And I would like to say thank you for everything. And I said, "Why are you thanking me? I should be thanking you." She looked, I can't describe or explain the look in her face. It wasn't with bitterness, just a tired smile where she said that I wasn't even thanked. I gave my
Mm.
best, and I don't know whether someone noticed that. I told her, "I would like to thank you for everything that you have done to patients. I would like to thank you for everything that you have done to everyone around." She had a tear in her eyes, and then after that, she walked away. The thing is that this moment stayed with me. Since then, I started seeing this lady everywhere I go. Not the loud ones, not the complainers, but the silent walkouts.
Mm-hmm.
On papers, the people are present, but in reality, they are actually not there. The ones who were once brilliant, kind, driven, still clocking, smiling, but their heart already gone. I mean, the people who were so skilled, they used to operate on things that no one else was able to operate on. The such complex cases, they were so enthusiastic. Where have they gone? I don't understand what's happening to them. They left quietly. Not because they are weak, but because they are tired of giving in places where no one listens.
Mm-hmm.
I'm not the kind of guy who gives, Kevin, I'm not the kind of guy who gives teaching lessons about leadership. I'd rather be on the floor with people, working with them and listening to them and listening to their concerns, and actually shoulder to shoulder, working with them shoulder to shoulder, helping them with all the struggles that are faced on daily basis. That's what I do every single day. The thing is that in theory, you have these workplaces where you have leaders and followers, but the problem in practice, it's a bit more complex than that. Because when the communication breaks down, when the values are ignored, when purpose is replaced by politics, people stop believing.
Yeah.
They and then when they stop believing, they will automatically stop giving, not with rage or rebellion, or just with quiet withdrawal. They are no longer with you.
Mm-hmm.
And they don't storm out, they just fade away. And my only worry here is that by the time the organization notices that, it's too late. It's too late. Chaos has already happened. The waiting times are already getting worse and worse, and patients are waiting longer and longer to be seen by doctors. Yes, we can blame system, but it depends what we want to blame in the system. So the problem is that the workplaces at the moment are becoming too political, not
Mm-hmm.
purposeful, protective and not passionate. And they are becoming so political that you can't get your job even done. We are promoting mediocrity, not even excellence. If you work 5 hours or if you work 20 hours, you will be treated the exact same way. And you will not, no one will talk about the good things that you've done. People will only mention things when things go wrong.
Mm-hmm. So let me stop right there. And before you go on, are you seeing this across a spectrum of healthcare professionals? So you told the story
Yes.
about the nurse. So you're seeing the MAs, the nurses, the physicians, generalists, specialists. You're seeing this across the healthcare spectrum in the United Kingdom.
Yes, yes. which is very sad. The problem is that a simple question, that's what I do. A simple question. I'm going into the hospital in the morning and I go into the elevator. I should be using the stairs, but sometimes I'm very lazy. I use the stair,
Hmm.
the lift to go up
Hmm.
instead of using the stairs. And I go into the lift and I ask the person going into the lift, "Good morning, how are you?" What's the response? "Well, I'm here."
Mm.
Why is the response like that? "Well, I'm here." Or on a Friday, "I can't wait for the weekend to come." People are no longer enjoying what they do. I can tell you one thing, which is basically the problem is that people tend to blame the managers, they tend to blame the system, they tend to blame the bigger picture, but it's more complex than that. In some religions, actually, some people believe that if you want to make a difference, you have to change yourself first.
Hmm.
And you are a leader in your position, regardless to whatever your level is, regardless to what your rate, whatever, regardless to how old you are. Even if you're 20 years old, even if you're 30 years old. I mean, look at Alexander the Great. He was 20 years old. He was the king of Macedonia. Macedonia is one of the most beautiful places, by the way. It's a very, very nice
Hmm.
place to visit. And he didn't rule from a golden chair where he went and spread the money around and told people what to do. He went and led 10,000 men across deserts, mountains, fought with them, bled with them, shared their ratios, and he didn't shout orders from a place from safety. He actually was on the floor he was with them, shoulder to shoulder, fighting with these soldiers. Why do you think they followed him from Greece to India? Not because they told him, "Hey, I want you to follow me from Greece to India," not because he demanded that, but he demonstrated that. And the problem is that you have at the moment everywhere in the world. I've got thousands of friends in Europe in the medical field, and all of them say there is an issue with the healthcare system, that there is a shortage of staff and the demands are exceeding the resources that we have. So the last thing I would expect at the moment is for a person to start giving orders to the people on the ground without actually going to the ground and seeing
Hmm.
what's happening and listening to the people on the ground and actually helping them. You need to also be there on the ground and helping them. This is the thing. I mean, I want to give you just 2, 3 examples in history because I
Sure.
believe if you want to understand the present, you need to go back to history, which is
Yeah.
extremely important. How you can make basically a very big difference in the world that we are living in general. And when I say world, this applies to the healthcare, this applies to any single field. Gandhi, I've got many friends, Indian friends. The Indian country, it's a fantastic country, fantastic people. And I can tell you in a couple of years, India will have a fantastic future. Many people won't agree with me on this point, but Gandhi was one of the greatest. He was a great guy in India. People respected him. He was once in South Africa. He was on a train, and that train was full of people of white background they were not very elegant. They told him, "Listen, you don't belong in this train because you
Hmm.
are not the same color." So he could have gone home. He could have kept his head down. Instead, he walked 240 miles in the Salt March. No weapons, no shouting, just a purpose. He didn't walk out. He walked forward. So people need to just remember what we are doing in the healthcare system. This is not a 9 to 5 job. This is not a 9 to 5 job. I keep telling people this. And the way things are being managed, where people actually don't know we are looking at numbers rather than looking at the realities. This is my main thing, my main concern here. You can keep telling people, "Listen, I want to meet the deadlines. I want the 4 hour target in the emergency department to be met. I want every patient who comes through the emergency department to be seen within 4 hour time." You can keep saying these things. However, you can keep pushing, but if you don't provide the support,
Hmm.
you don't know how things will go. Because imagine you've got a chain and then you push the chain, you don't know in which direction the chain will go to. You remember Rosa Parks. Rosa Parks, a very famous lady. One seat, one woman, and one no. She wasn't trying to spark a movement or create a big issue in the world. She was just tired of being invisible.
Hmm.
People need to have a say. People need to be able to express their thoughts and opinion in the environment that you work in because you matter. As a person, you matter. This is what matters. The fact, something in the UK that I always tell people, when I was a medical student, I attended a lecture a very long time ago, and a person came all the way, I think 2, 3 hours drive, and he started giving a talk about whistleblowing.
Hmm.
And I mentioned to him, "Why whistleblow? Why not highlight concerns and speak about things openly and publicly?" And he said, apparently, if you whistleblow, you are protected. So I said, why don't we protect people who highlight issues and concerns in general rather than
Hmm.
whistleblow? And then if you actually provide freedom of speech, if you provide the support and a nurturing environment to people working in the environment, and I can tell you, people will be working happily. And I always say, don't blame the system. Even if there is long waiters, even if there is issue with cancellations, with bed situations all around the world, don't walk out.
Hmm.
You need to help. Mandela, when he was treated badly, I'll give you an example, 27 years in prison, he was freed. He didn't go and seek revenge. He didn't say, why did they do this? Why did they do this? He went and sought unity. He led a divided country towards forgiveness. Some of the strongest people don't walk out. They actually wait, prepare, and then they rebuild. And that's what I keep telling my colleagues. We need to stand together. We need to identify what is going on here in the healthcare system. We need to see how we can provide the best treatment for patients. Yeah,
So you're describing a situation that's happening both in the UK and the US. People
yeah,
are quiet quitting, that's showing up but not really there.
yes,
Surely the
yes.
healthcare leaders may be seeing this. So,
Yeah,
in general, do they acknowledge this?
yeah.
What are they doing in response to this?
I'll tell you what's happening. The reality behind that is that they know about it. I don't know whether it's being acknowledged or not.
Hmm.
That's the reality. I would expect if people are struggling on the floor for the leaders to go on the floor to help the people working on the floor. Florence Nightingale was a very, very respected lady. She walked around the blood-soaked wards of Crimea with the other nurses, not carrying a flag, but carrying a lamp. She cleaned the wounds, tracked statistics, and reformed hospital care forever. She didn't basically tell people, listen, there is an issue, I know about it, I'm not going to address it. The problem is that people at the moment, and I wouldn't call them leaders, but I would call them managers working in the healthcare sector, they are not thinking about the future of of the patient care, and they are more thinking of how can I make sure that this organization looks better from a number point of view or from a statistics point of view.
So you're saying that there's a definite disconnect, like you're not seeing any healthcare leaders go to the floor and see what's happening at the patient level.
You will find every now and again, some I've experienced, you will find every now and again a couple of leaders, whether it's a matron, a leader does not need to be a manager, by the way. A leader can be a simple consultant even in the department. You don't need to be a manager because a consultant is still a role model for his juniors, you know. And even a consultant, imagine you're sitting home asking the residents in the hospital to do all the work for you, and you tell them what to do over the phone,
Hmm.
and they are struggling. They are struggling. There is a lot of workload to be done. Instead, he should be going to the hospital and helping those residents with seeing their patients and making sure they are provided with safe, effective care. This is the issue. People just need to be more visible. People need to be, you can't put yourself in a room, in a locked room, on a chair, looking at data without actually seeing what's happening on the floor. That's my issue. Huh?
Now, what about the healthcare workers who feel trapped, workers that are silently quitting? What kind of
Yeah.
advice do you have for them, whether to stay in that organization or look for someplace else?
Well, it depends. How strongly do you believe in the values that you own? They say we are all rendered fit members of a regularly organized community. We are all, imagine it, you imagine yourself living in a gentleman's club, for example, and then you only, if you want to be a member of that club, you either have to abide by the rules or you can't be part of the club. But sometimes clubs can be sometimes flexible. And the same with hospitals. The thing is that it all comes to the people in the healthcare system. Martin Luther King said, we will remember not the words of our enemies, but the silence of our friends. He spoke for the voiceless, listened to the unheard, and that is what made the difference. If people are promoted to express their views and thoughts in the environment that they are working in, I can guarantee you, even if you don't provide them with what they need, they will still be happy. I promise you. This is the thing. Unity is the key. Whatever you do, unity is the key. People need to stand together. You can't
Mhm.
separate management. You can't separate a hierarchy system exists. And you need some hierarchy system because otherwise it will be chaos. 95, I always tell people 95% of the people are average intelligence. This is statistics. 2.5 are above average, 2.5 are below average, but most of us are designed to be led. Most of us are not designed to lead. So if there is no leader within the group, it will be a chaos. Everybody will be doing their own thing. And that healthcare assistant, empower them. Go to them. Ask them, how can I help you? What can I provide for you? Is there anything that, and even if I can't provide, even if I can't provide anything, I can tell you, I work with many people from the, with refugee camps, many people from the war zones. I can tell you they work in many, like I worked with many people from low resourced places. They are still happy. Why? Not because they have everything, but they had each other. That's the thing that I need to highlight. Okay.
Now, is there any hope of turning around? Have you heard a success story where people or healthcare workers who have been silently quitting have been re-engaged? Have you heard of a successful turnaround story?
Well, there will be always individual success stories, but I can tell you, yes, there is. You can make a massive difference. I want to give you a political example, which has nothing
Okay.
to do with healthcare. Yeah. So look at after the World War, what happened? Enemies became allies. You know, the NATO, look at Washington Treaty. NATO was born 34 countries, they united, not to conquer, but to protect. Countries that once faced each other across battlefields, they stood together to protect each other because they knew that unity is not a luxury, it's the only mode of survival. So I can tell you, yes, I know someone who basically was zoned out, he didn't enjoy what he did, and after that, the management or someone spoke to him, he started enjoying the job again. But let's go back to the core values here.
Yeah.
And the core values say very clearly that regardless to our differences, all it takes is one person to make a difference. All it takes is one person. You can have, I know a department, imagine NATO, so many countries, different religions, different backgrounds, different politics, and that's actually what makes our field special. We treat everyone equally, regardless to whoever they are, whether they are the king, whether they are the queen, whether they are the managers, the domestics, everybody's equal. No one cares who you are. You get treated exactly the same way. But we need to ensure that someone implements that system, and that is the leadership within the organization. That is the most important thing. Huh? So purpose, respect, and unity. That's the thing that I can highlight.
We're talking to Suhaib Ahmed. He's a surgeon in the United Kingdom. Today's Kevin MD article is Why Even the Best Employees Are Silently Quitting Healthcare. Suhaib, let's end with some take-home messages they want to leave with the Kevin MD audience.
When people feel safe, seen, unheard, they stay, they fight, they care. If I see someone being treated unfairly, whether they are a nurse, whether they are a manager, whether they are a doctor, that matters to me, even if they are not my family. I tell all of my friends who work in the management fields, or whether all of my friends who own businesses, go to the grounds and listen to people, listen to what they have, and ask them a question. Ask them a very simple question. What don't we talk about here, but should? And then stop, don't defend, don't fix, just listen to what they want to say. And then they begin to heal. When they heal, they care. And when they care, they stay, and they will start enjoying the job that they are doing. This is the thing. And then when they stand together, this is where the biggest difference and the biggest change can happen in the organization. I hope, I have faith that we will stand together despite the limitation, despite the challenges that we have in the system, to make a difference, to change the environment that we are working in, making it more positive. And remember that you can still be happy in a low-resourced place. So you can't simply say, just because I didn't get approval to get this device, I'm a surgeon, I want this most complex device, and just because I didn't have it, I'm not going to be happy, and I don't want to work in this place anymore. No, you can simply say, okay, if I was the owner of the place and I say, listen, I've got limited budget, I can't do that to you, I can't provide you with this equipment, but can we work together on something else? I'll make you lead another project to change the environment. I'll nurture you. I'll give you some empowerment in the environment that you are in. So thank you, Kevin, for this great chat that we had together.
Suhaib,
Yeah.
thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank you very much for that. Thank you.